Do you take blood pressure meds every day but still feel dizzy, weak in your legs, and constantly tired? Have you ever wondered if those side effects are normal? Or if something's wrong with your treatment? Even worse, maybe you've already thought about stopping the meds on your own, thinking your body is used to it or that everything seems fine. But what really happens if you skip 1 or 2 days? In this video, you'll learn why so many blood pressure meds cause side effects, what happens when the doctor increases your dose, whether it's possible to safely reduce your pills, and the real dangers of stopping treatment without guidance. This isn't lab talk. It's a simple, straight explanation made especially for you, someone who's been through the ups and downs of high blood pressure and just wants to live with more ease, safety, and independence. Watch until the end because this information might help you avoid a heart attack, a stroke, or even an unexpected hospital visit. And more, you'll see that yes, it is possible to control your pressure with fewer meds if you know the right path. If you've ever taken blood pressure meds and felt dizzy, tired, had headaches, or even swelling in your legs, know that it's more common than you think. Many men between 60 and 75 experience these side effects even when following their doctor's orders. But why does this happen? The truth is, most blood pressure medications work by forcing the body to lower pressure quickly and directly. That might mean relaxing blood vessels, slowing the heart rate, or flushing excess sodium out through urine. While this helps control pressure, it can also affect other systems like balance, digestion, sleep, and even sexual function. And as we age, the body doesn't respond the same way to medication. The liver processes things slower, the kidneys filter less efficiently, and the risk of drug interactions increases, especially if you're also taking pills for cholesterol, diabetes, or pain. Another key point, not every body reacts the same. What works well for one man at 60 might cause dizziness or weakness in another. That is why doctors often need to adjust the dose, or even switch the medication multiple times to find the right one. The problem is, many men get discouraged or even stop taking their meds on their own, which is dangerous. Pressure can silently rise again, increasing the risk of heart attack or stroke. That is why it is essential to talk to your doctor about side effects and explore natural alternatives that can support pressure control. There are foods, herbs, and simple habits that, with the right guidance, may help reduce your need for medication and improve your quality of life without nasty surprises. Taking care of your health isn't just about popping pills. It is about understanding what is going on inside your body and seeking balance in a smart way. Yes, it's dangerous and more common than you think. Many men with high blood pressure decide to stop taking their meds on their own, either because of side effects, because they feel fine, or because they're looking for more natural solutions. But that decision can be risky, even deadly. High blood pressure is a silent condition. Even when you feel okay, it could be quietly damaging your heart, kidneys, eyes, and brain. Suddenly stopping medication can trigger a rebound effect, where your pressure shoots up fast, sometimes to dangerous levels, and that raises the risk of heart attack, stroke, and other serious problems. Plus, your body gets used to having that medication. Removing it suddenly can throw things off balance. This can lead to hypertension spikes, chest pain, dizziness, nosebleeds, or even fainting. It is important to understand that blood pressure meds don't cure hypertension, they control it. And the ideal scenario is to combine that control with real lifestyle changes. Cutting salt, eating more potassium-rich foods, walking daily, staying hydrated, and reducing stress are all steps that help your body work better. Over time, those changes may even let you reduce your dose, but always with medical supervision. If you're tired of taking meds and want another path, talk to a professional first. There's no shame in exploring other options as long as you do it responsibly. Your body deserves care, not risk. Stopping your treatment on your own is like turning off a fire alarm just because the sound is annoying. It might seem like a quick fix, but it could cost you dearly down the road. Yes, there is, but it needs to be done carefully and always with your doctor's supervision. For many men between 60 and 75, the desire to reduce their blood pressure meds comes from wanting to avoid side effects and regain control over their health. And it's possible as long as it's done the right way. The key is building a strong foundation of natural habits that help your body regulate blood pressure on its own. Once your system starts responding well, your doctor can consider gradually lowering the dose, or even stopping a medication over time. But pay attention, this doesn't happen overnight. The first step is improving your diet. Cut back on salt, eat more potassium-rich foods like bananas, avocados, and spinach, drink more water, and consider vasodilating herbal teas like hibiscus or garlic. These are simple changes that can already make a difference. You also need to stay active. Light walks, stretching, and deep breathing exercises help boost circulation and keep your heart more balanced. Another important factor is stress control. Techniques like meditation, calming music, or even gardening can help your mind and body stay in harmony, and that directly affects your pressure. With these lifestyle changes, many men succeed in stabilizing their blood pressure naturally. That's when your doctor might begin to lower your medication slowly and safely, with regular checkups and pressure monitoring. Remember, the goal isn't just to take fewer pills, it is to live with more quality, ease, and safety. Reducing meds without building this healthy base can be risky. But with the right steps, yes, you can regain control and feel better every single day. A lot of men wonder, if this med already makes me dizzy, why would the doctor increase the dose? It may sound strange, but there's medical logic behind it. When your blood pressure stays high even with medication, your doctor has to act to prevent something worse, like a heart attack or a stroke. In that moment, the priority is protecting your vital organs. High blood pressure, being silent, can damage your body without clear symptoms. That's why, if it's still not under control, your doctor may choose to raise the dose to get results faster, even if it means dealing with temporary side effects. It's a tough choice, but it's based on risk versus benefit. Another important point. Many times, doctors don't realize how much patients are suffering from side effects. A lot of men keep quiet, thinking dizziness or weakness is normal. But if the doctor doesn't know, they can't make changes. Also, most medical guidelines focus on controlling blood pressure effectively, even if it causes discomfort in the beginning. The idea is to stabilize things first, then adjust the meds later if needed. So, what can you do? Be honest with your doctor. Tell them everything: dizziness, weakness, swelling, fatigue. The clearer you are, the easier it'll be for them to find alternatives like switching medications, splitting the dose, or even reducing it if your health habits are improving. The good news is, many of these side effects are manageable. And with healthier habits, there's a real chance to reduce your dependency on medication over time. Just don't make decisions on your own. Your doctor is your best ally to live with more freedom and confidence. It might seem harmless to miss your blood pressure medication for a day or two, but it can be more serious than you think, especially if you've had high blood pressure for years. Most hypertension meds need to be taken every day at the same time to keep your pressure under steady control. When you break that cycle even for a short time, your pressure can rise again quietly without noticeable symptoms. In some cases, this rebound effect can be intense. Your body, used to the constant presence of the drug, reacts sharply to its absence. The result? A fast spike in pressure, more strain on the heart, tighter blood vessels, and a much higher risk of heart attack, stroke, or heart failure. For some men, skipping 1 or 2 days might cause just mild discomfort. But for others, it can trigger a serious crisis, especially if they already have other risk factors like diabetes, obesity, or history of heart problems. On top of that, getting back on track with your meds isn't instant. Just restarting doesn't immediately reset your pressure. Your body takes time to stabilize again. If you forgot to take a dose, the best thing is to take it as soon as you remember, but never double up to make up for it. And if forgetfulness happens often, try setting reminders. Keeping your meds near your toothbrush or asking someone you trust to help you stay on schedule. Managing blood pressure is a daily commitment to your life. Small slip-ups may seem harmless, but in a body that's already vulnerable, they can make a big difference. Staying consistent is one of the greatest secrets to living safely and well.
Watch this video now, it will be useful to you. Let's go, believe in me. Don't miss this chance.